Hello, Namaste viewers. Welcome back to our channel Physio Healer. Today we are going to discuss about importance of past medical history, drug history, family history, social history, occupational health screening questions for physiotherapeutic assessment and questions to ask while taking these histories and some tips for patients about discussing past history for getting the most out of physio appointments. This is very important to rule out sinister pathology and also get an idea of how generally well the patient is and what other things they may be dealing with, which may guide your clinical reasoning process. So, let's start with past medical history. Important questions to ask while asking for past medical history are any weight loss, because rapid weight loss without cause can indicate cancer, unexplained fever or night sweats. It is prevalent in leukemia as well as in infections and lymphoma. Chronic fatigue could indicate other systemic problems that the patient is not aware of. Our key acronym to remember the questions which are supposed to be asked while taking past medical history is #ThreadSocks. So first the hashtag is the hash, and that's because the medical sign for a fracture is a hash. T stands for thyroid conditions, R stands for rheumatoid conditions, E stands for epilepsy, A stands for asthma and other breathing pathologies, D stands for diabetes, S for previous use of steroids, O for osteoporosis, C stands for a personal or family history of cancer, and S on the end stands for history of surgery. Starting with drug history. Getting an idea of the patient's medication will also give you an indication of their general health, as not all patients divulge a full medical history when you ask them about it. The types of medication they are on will give you an idea of what they might be suffering with or managing from a health perspective. If they have been taking any steroids or anticoagulant medications, why? Well, the prolonged use of steroid is linked to osteoporosis, which may contraindicate physiotherapeutic techniques, for example, joint manipulation, or could help you with your clinical diagnosis. For example, you could consider an avascular necrosis of head of femur for your patient with hip pain who has been taking steroids for many years. In terms of anticoagulants, the use of anticoagulants is a contraindication for aggressive manual techniques including massage and manipulation, and is also a contraindication for acupuncture. Now, from a patient progress perspective, knowing the dose of the type of analgesic they are taking is a paramount. For example, the patient who says their pain has been the same for last 2 months may not have told you that they are now taking higher dose of tramadol or analgesic medication, and this may indicate that their pain could actually be considered as worse. Likewise, your patient may be improving if their pain is the same, but their analgesic dose is reduced. So in the dosage, if you can become familiar with the regular drugs that come up again and again, so that you understand why the patient may be taking them, and if you haven't heard of particular drug before, do ask your patient why they are taking it, as it may well tell you about an additional medical condition that you didn't know. It's also helpful to know which drugs are anti-inflammatory, which, for example, codeine or neuropathic based in nature, so you can figure out if your patient current analgesic regime is appropriate for their condition or not. So for example, are they taking a neuropathic medication such as gabapentin for their shooting burning nerve pain? If not, you could ask them to speak to their doctor who could review their analgesic dosage. So now we are going to talk about family history. Family history includes 3 generations: parents, siblings, children, grandparents, spouse, partners. For living age, health; for deceased age, cause. Include genetically significant diseases and chronic illnesses. For example, family history of diabetes, cardiovascular diseases, cancer, renal disease, neuromuscular diseases, bleeding, diathesis, psychiatric illnesses, substance abuse, and any significant communicable diseases like TB, HIV or hepatitis. Include any appropriate psychosocial or risk factors. Information regarding primary decision makers in the family. Short form to remember for family history is families, a useful mnemonic for assessing the type of support provided to the patients by their family members. F stands for financial, A for advocacy, M stands for medical management, L stands for love, I or E stands for information and education, S stands for structural support. This short form was developed by Dr. David Swee, Department of Family Medicine and Community Health of Rutgers University. Now starting with social history. Here you are going to ask about where, with whom and how a patient lives. Patient's birthplace, significant travel or migration history and current residence. Education of the patient, occupation, occupational exposures of the patient, environmental exposures such as home or community, past, current or future lifestyle or home-based situation, social supports available for the patients, hobbies of patient, pets if the patient owns, socio-economic issues if patient has any, a mnemonic for addressing the social determinants of the health. This is thesis. So T is transportation, H for housing, E for eating, another E for education, S for safety, E stands for economics, U stands for utilities, S stands for social support. So this was developed by Robert C., MD and MS and Department of Family Medicine and Community Health of Rutgers University. Now starting with some occupational health related screening question to ask to your patients. So first question you are going to ask is, what type of work do you do? Do you think your health problems might be related to your work? Are your symptoms different at work and at home? Are you currently exposed to chemicals, dust, metals, radiation, noise or any form of repetitive work? Have you been exposed to chemicals, dust, metals, radiations, noise or repetitive work in the past? Are any of your co-workers experiencing similar symptoms? Is the answer to one or more of these questions suggest that a patient's symptoms are job related or that the patient has been exposed to hazardous material, a comprehensive occupational history should be obtained. Now it's time for some tips for patients about discussing past history for getting the most out of your physio appointment. Think about the concerns and questions you have for your physio appointments. Write them down. Start with what is most important to you and end with the least important part. Bring the list of your visit. Be ready to work with your physio to reorder your list if needed. If you are a new patient, bring as much information as possible with you to help your new physio learn your health history. If you are not a new patient, you only need to bring the information with you that is new or has been changed since your last visit with your physio. Write down your health history. You can create a health journal if you want for yourself on paper or on your computer. Your health journal can include things like health problems you have or have had, blood pressure numbers, recent symptoms, any sleep diary if you want to maintain. Bring the journal or health history to your appointments. Take any x-rays, test results, medical records if you have. Your physio can look at these to get more information on your health. Make a list of all the medicines you take. Include the information about when and how often you take the medicine. Write down the strength of the medicines also. For example, do you take 150 mg or 200 mg? The list should also include any vitamins or supplements if you are taking. Talk to your family member to see if they can come with you to your appointment to listen, to take notes and ask questions. If you have any questions or suggestions for us, you can write down in the comment section below. We'll try to reply as many as we can. Thank you for watching today's video. See you soon next time. Stay tuned. If you like today's video, don't forget to like, share and subscribe us.